And let's get right to our top story tonight at 11. There are sobering new estimates of how bad this pandemic could get here in the United States. Earlier today, the president shared new projections showing there could be between 100,000 and 240,000 deaths nationwide if everyone follows social distancing measures. So that's the best case scenario. Now, if we do nothing, the president's health experts think between 1.5 million and 2.2 million people would die from this coronavirus. I mean, think about these numbers. That's why the president's team is extending social distancing guidelines for another 30 days. The president is urging you to take this warning seriously.
It's absolutely critical for the American people to follow the guidelines for the next 30 days. It's a matter of life and death, frankly.
The death toll here in the U.S. has now climbed to more than 3,700, with the hotspots being New York, New Jersey, and Connecticut. Health leaders continue to say we all have a part to play in fighting this coronavirus. Remember, there's no vaccine, no treatment yet. So here's what all of us need to do. Continue to practice social distancing. Continue to keep washing your hands. We've got to slow this spread. Lives depend on it. New tonight at 11, a request from first responders across our state as a growing number of them now test positive for the coronavirus. Today alone, we learned 12 IFD firefighters and a dozen IMPD officers tested positive. Their request tonight is simple. Be honest about any symptoms you may have when calling 911. Tonight, our Emily Longnecker shares the story of one paramedic already worried about what he might have been exposed to.
Hi, Scott. I talked to a paramedic tonight who works for Pike Township. His voice and perspective on this situation are very unique, and that's because in January he came back after serving in Iraq with the United States Army. Now he's got another very important mission right here in his hometown. As a platoon sergeant and critical care flight paramedic in the United States Army, Troy Thomas has seen every kind of human suffering.
You pretty much name it, we've pretty much seen it.
Both here in the United States on humanitarian missions like the one in Houston during Hurricane Harvey.
People literally stuck in their attics, trying to get helicopter rides off the attics.
To combat zones in Afghanistan and Iraq.
Women, children, old people, treat Americans, we treat our coalition partners, and I've treated enemy. The people that were trying to hurt us, the people that were out hurting civilians.
Now back home only 2 months, Thomas is in another combat zone of sorts. This one against an enemy he can't see, COVID-19. Monday was his first day back on the job as a paramedic with Pike Township EMS. And the first patient he saw likely had coronavirus.
It was a very difficult situation, but that particular situation. But, you know, this is what it is. And you just got to put your pants on and do the work like you're supposed to do it.
Work that carries a risk for exposure. Already, fire, police, and EMS departments across central Indiana, including Pike Township, have reported having members who've gotten sick and tested positive for the virus.
It's an evolving thing. And so we've learned more about it and learned more how to combat it and deal with it. And what are the best responses.
For the public, Thomas says the best response is to stay home.
You are saving lives every day by doing the right things. It's one team, one fight.
A fight that's hard to tell how long the battle will last. A lot of people like Thomas on the front lines, but he said tonight that we're in the battle too, and we're doing our part when we stay right here at home. Scott?
All right, Emily, thanks. And our other big concern this evening is making sure all the healthcare workers have enough protective gear to keep them safe from the coronavirus. Tonight, our Rich Van Wyk found a hospital in Boone County making the most of their masks.
This is a high-tech version of the laundromat.
It is. Specifically designed for N95 masks.
And they hang on the clothesline.
They do.
And they're radiated with ultraviolet?
Yes.
And what does that accomplish?
Well, it kills viruses like COVID. Exactly what we're trying to accomplish.
The Glitzy washing machine is normally used to bathe operating rooms with germ-killing ultraviolet light. Typically, the clotheslines are filled with masks.
And we rotate them over a cycle, inside and out, and then they hang them so that the inside is exposed to the light. We also have quality control coins that measure the right amount of exposure at different levels, and that's why we The lines have been set up the right distance from the machine.
At Witham Health, doctors and nurses will find their masks on the line, waiting to be reused.
Let's break down the numbers so you have a better idea of the coronavirus pandemic across Indiana. We had 373 new cases since yesterday, bringing our total up to 2,159. 14 more Hoosiers have now died from COVID-19, bringing our death toll up to 49 across the state. But tonight I want to give you some more context so you have the facts, not fear. This is the largest single-day rise in deaths we've seen since Indiana recorded its first death back on March 16th. Now, state leaders are telling us the surge is starting, but the peak is still weeks away, sometime between mid and late April. So Indiana right now is preparing for an increase in positive cases and deaths. Right now, hospitals are working to get more beds, ventilators, and healthcare workers to make sure they're equipped to handle the surge. Let's break down the state numbers for you and show you the map of Indiana. The counties that are in the darker red have the highest cases. So while you do say Lake and St. Joseph County with high numbers, let's concentrate on what's happening here in central Indiana. In Marion County, 964 confirmed cases of COVID-19 and 17 deaths. In Hamilton County, 127 cases, and down here in Johnson County, 101 cases. It's important to note, though, that Hamilton and Johnson County have two of the larger populations across the state. We're also seeing an increase in testing across the state. We've had more than 13,000 Hoosiers tested so far. Only a couple thousand, though, have tested positive in Indiana.